Well, good afternoon and welcome. I'm Beth Stewart, the Executive Director for the Texas Oral Health Coalition, and I would like to welcome you all to today's webinar called Catch Healthy Smiles for Oral Health Promotion in Schools for Elementary School-Aged Children, presented by Dr. Shrila Sharma. Our presenter today is Dr. Shrila Sharma, a professor of epidemiology at the University of Texas School of Public Health in Houston. Dr. Sharma is a behavioral epidemiologist with a specific focus on understanding and addressing disparities in food insecurity, healthy eating, and chronic disease prevention, including childhood dental caries and obesity. She also serves as the principal investigator of the NIDCR-funded Catch Healthy Smiles randomized controlled trial in Harris County. We're very excited to have Dr. Sharma present today and learn more about this special program. So please welcome Dr. Sharma.
Thank you so much, Beth. And I will go ahead and share my screen. So again, thank you very much to the Texas Oral Health Coalition for inviting me to present today. And I'm happy to take questions at the end, or you can feel free to contact me even by email if there's any follow-up questions. I'm going to speak a little bit about Catch Healthy Smiles randomized controlled trial that we're doing for oral health promotion among children in grades K through 2 here in Houston, Texas. I'm a professor of epidemiology at the University of Texas School of Public Health. Before jumping into the presentation, I just want to acknowledge that this work is possible because of multiple partnerships. Anything in public health, as you all well know, is about partnerships, and none of this would happen without our partners at Harris County Public Health, Dr. Johnson, Dr. Keela Johnson, Dr. Shalisa Gardner, who have been seminal to all of this work, and then also to the Catch Global Foundation, which is a 501(c) nonprofit that actually supports the implementation and dissemination of all Catch programs. So I'm going to give a little bit of background, which is for this audience is you all are the experts, but I wanted to funnel it into a little bit of the why behind us. You know, I'm not a dentist by training, but why is this an issue that we decided to tackle? So a lot of my research has been around food insecurity and healthy eating, specifically among underserved communities. And as we were doing this work, one of the most common problems that we encountered, especially among children, most of my work is in schools with children. And one of the issues we consistently encountered was that of dental caries. And as you all well know, it's the most common childhood disease in the US, and it's definitely an epidemic. And we have over 60, almost 70% of children in Texas with tooth decay, which is much higher than the national average. The 2018 kindergarten oral health screening survey showed that there were about 5 out of 10 entering kindergartners with tooth decay, which is much higher, almost twice what is the target for children with tooth decay. So we definitely have an issue, and as you all well know, starting with even with early childhood. One of the challenges as a result of the COVID-19 pandemic is that millions of children missed their dental appointment just into 2020, an estimated, which is a very conservative estimate, of 9 million children missed dental appointments in 2020. And in addition to that, we know that dental problems lead to a lot of missed days at school. And so 51 hours of school are missed each year due to dental problems. So if we have 7 out of 10 school children in the U.S. struggling with dental issues, that can result in a lot of missed hours, which is a significant problem when you think about funding as well as academic achievement. In terms of funding, school districts in Central Texas reportedly lose over $90 million in funding every year due to absences. Some of them, these absences we know are related to dental problems. In schools, this data is a little bit older, but specifically from the Houston Independent School District, about 9% missed 18 or more days during the school year. And children from low-income families were more likely to be chronically absent than their peers. And the chronic absence was higher in the younger years. And of course, as we can imagine, students who did attend school more regularly had higher level of scores on their standardized tests. So there's data to also suggest that children with poor oral health are more than 2 times more likely to perform poorly at school. And when we look at the data on academic achievement, specifically on missed school, this is just looking at chronically absent in red across the various grade levels, starting with 3rd grade, which is when STAR test is initiated, and then those who are not chronically absent. And you can clearly see that regardless of grade, chronic absence at school can result in lower academic achievement. So it's health, it's physical health, there's mental health, but then there's academic achievement when we talk about children and dental problems. When one of the, we've done several pilot studies to lead up to this particular work that we've been doing. And one of the interesting pieces of data that bubbled to the top was that between both teachers and parents, there was a very strong concordance that baby teeth do not matter. And we know that that is absolutely not correct. Children with cavities in their baby teeth are 3 times more likely to get cavities in their adult teeth. But when we spoke with teachers as well as school teachers as well as parents, they did not perceive it to be so. So there was definitely a discordance between the knowledge, the fact, and the perception. We also know that kids do not develop their motor skills to brush and floss effectively until about the age of 8. And supervision is needed with ongoing reinforcement to address and ensure that we are establishing good toothbrushing and flossing skills. So schools can make a big impact. In fact, if you can, then you must. When you have an epidemic of this proportion, we have to respond to it aggressively. And so especially when the issues are modifiable, right? Tooth decay and gum disease are preventable, and we need to start early with children. And so schools need to be part of the solution, because the 2 environments in which the child resides the most is the school and the home. So we need to impact both environments to have a significant prevention effect when it comes to tooth decay and gum disease. So to address this issue, in 2013, the Texas 83rd legislative session added oral health as a required topic to the state education code. Now, what's interesting about this particular mandate is that it is unfunded. And as with many policy mandates, the implementation is not monitored. And and neither are resources available in a systematic way to schools. So that is a particular challenge because we cannot expect schools to generate educational materials around complex issues and and then you run the risk of them not being evidence-based and hence not effective. Which leads us to Catch Healthy Smiles. And I have pictures to show a little bit, quite a bit more about Catch Healthy Smiles. But it's a school-based oral health promotion intervention. And it's based on the CATCH framework. CATCH stands for Coordinated Approach to Child Health. And CATCH is a Texas Education Agency approved coordinated school health program. What's important about CATCH is that it was actually developed by investigators around the country back in the late 90s. It was a trial that was funded by the National Heart, Lung, and Blood Institute that was specifically targeting improved cardiometabolic outcomes in children by improving their diet and physical activity behaviors while they're at school. The study was found to be effective. And what was really interesting is that NIH then came back and said, well, we want you to disseminate the program. One interesting fact about health promotion programs is that 9 out of 10 health promotion programs that are found to be effective in NIH trials sit on the shelf because there is no platform for dissemination. As a researcher myself, I will tell you that it is very, that's not something we're taught in schools. We're not taught the business model of disseminating programs once they're found to be effective in our clinical trials. So, however, back in the late 90s, NIH worked with the investigators and developed a platform for dissemination. And so since then, CATCH has been disseminated to several million children and through schools over, I believe it's 15,000 schools in the country. It's approved by Texas Education Agency as a coordinated school health program. And what that means is that schools can implement CATCH as part of their regular curriculum. So they can use CATCH materials in their math, in science, in language arts, and deliver nutrition education, physical activity, and other health promoting behaviors as part of the program. And I'll tell you a little bit about how it's disseminated because it's an interesting model. It's certainly universities are not set up for large scale dissemination, which is why it's actually housed under its own nonprofit called CATCH Global Foundation. So with Catch Healthy Smiles, it's based on the same principles of CATCH, which it's grounded in the social cognitive theory constructs, and I'll show you all the logic model in just a minute. But it helps students, so children and their families, children who right now we have developed the program for children in grades K through 2, develop their oral healthcare knowledge, skills, habits that are needed to prevent decay. The program consists of 4 main components, and I'll share all of those in a minute in detail, but there's a classroom curriculum, there's a toothbrushing routine in the school. So this would be the first time that we would actually have institutionalized toothbrushing inside elementary schools on a routine basis. There's a very robust parent outreach and school environmental components because, as I mentioned earlier, we have to address the environment that the child is living in to maintain the behavior changes as well. So we did pilot testing. We've been working on this for 5 years now, and we've done pilot testing of the program, which showed strong feasibility. However, the efficacy, does it really impact Caries incidence? That was the question. The efficacy remains to be seen. So I know this is dense, but I'm not going to go through every word. but I just wanted to show everybody the logic model that the program is based on. It's based on the science that we know about behavior change using the social cognitive theory constructs. I'm just going to go through this at a very high level here on the left and then on the very right. So the components, there's a very robust training component, but this is a school-based program, which means that the school is actually trained in implementing the program. So we have a very robust school training piece where we train school leaders as well as teachers in implementing the program curriculum materials. And then we provide them with the materials that they need. We have, for the toothbrushing, tabletop toothbrushing routine, we have toothbrushes and toothbrushing kits that go home. We have toothbrushing that happens in the classroom, and we have kits for that. And then we have a whole robust classroom curriculum that I'll show how it's delivered in a minute, but it's available online on our Catch Global Foundation platform, as well as several other extension activities, PE activities to reduce dental trauma while children are being active. And a very robust videos and posters and stickers to just change the environment at the school in regards to oral health. There's a Catch communication component. So we have scripts that we share with the school leadership so they can use it in their morning announcements to deliver oral health promotion messages. We work with the school health advisory committee and the faculty to educate them on what we're doing. This really, I mean, when you're dealing with an epidemic as pervasive as dental caries, we have to elevate the knowledge of everybody who's working with the children. We have, Catch has their own technical support. So we have our own technical support that provides ongoing technical assistance to the school. You don't want to train someone and then just, bless forth and, do your, and go. You have to provide ongoing technical assistance. And then last but not least, we have parent outreach materials in English and Spanish that include a lot of infographics, videos. We even have books we send home, reading books we send home to the children. With the children, we have books in the classroom that are focused on oral health. So it's about introducing the language about oral health in the school and at home, and reinforcing it in every environment that the child is in. And then these are, in the middle, all of our core components and what we are trying to change. But ultimately, the outcomes we are trying to target are both behaviors. So you'll see a list of various behaviors here related to both oral health as well as healthy nutrition, because our classroom curriculum consists of both. I want to, say that these components were co-created by our partners at Harris County Public Health. So we had an extensive amount of dentist input in developing all our intervention materials. And then the physiological outcomes that we're really interested ultimately is in reducing the incidence of dental caries. We're also looking at oral health related quality of life for the children. So this is, I'm not going to read everything, but essentially I did want to share that we're doing a randomized controlled trial to see whether the program is actually effective in reducing incidence of dental caries. We're working with 26 schools in Houston. And what we're doing is we're enrolling children in kindergarten and then following them, implementing the program over 3 school years, kindergarten, first and second grade. and then assessing the impact on caries, incidence of dental caries in the children. And we are primarily working with schools that serve children from low-income families. So these are schools where over 75% of the children are on the free and reduced lunch program. And that's primarily because the disparity when it comes to caries is pretty evident from the data. These are the study aims that I just mentioned. I just want to also say we are using ICDAS as our measure of assessment for caries risk. Our team dentists are doing all of this. So they've been trained and are doing the assessments. And then we are also assessing a lot of behavior changes, because behavior change is the first step towards addressing caries prevention. And so we are looking at toothbrushing frequency, we are looking at diet, we are looking at oral health quality of life, flossing. We also have flossing frequency behaviors here. Do you have access to dental care? And then we also look at the school and home nutrition environment. So we're collecting a lot of data, and this is our team in terms of who all have been involved in the team here. This is the core team. There's a lot of other people who are part of this team, but just from our core team and subject matter experts. I just wanted to share what our org chart looks like. So right now, we have 26 schools, 13 schools that are receiving the program, and 13 schools that are what we're calling our comparison group. So they're receiving a sun safety curriculum. We're providing the children with sunscreen, there's a whole educational piece. This is also an evidence-based curriculum and developed by MD Anderson Cancer Center investigators. And both these programs are delivered through the Catch Global Foundation website. And so it's nice because it really allows for a very appropriate comparison group. So everybody in these schools get Catch Healthy Smiles. Everybody in these schools get the Sun Safety curriculum. As I mentioned earlier, we're doing examinations. So we have children who are getting enrolled here in kindergarten, and then we have 3 time points of follow-up with the children, with the parents, and with the schools to assess all of those, to assess essentially if the intervention of Catch Healthy Smiles is actually having an impact. I'm not going to go through this. I want to primarily focus on the program, but I just wanted to share that the exposure to the program is built from kindergarten. Second year, we add kindergarten and grade 1, and third year, we add kindergarten, grade 1, and grade 2. And those are aligned with all of our measurements as well that we're doing. This is a big shift for the schools because it's not, they have to be trained and adopt and implement, have a staggered approach. Otherwise, you're not going to achieve successful implementation. So I wanted to share, if anybody is interested to know how do you get started, you enroll at catchhealthysmiles.org. It's all electronic and online in terms of getting access to the training and the program materials. The delivery is in person. This is a coordinated school health program that's delivered in the schools by school staff. However, the platform on which all of the materials are located are available online, and that does allow for ease of dissemination. And I have some screenshots to share, but this presentation, I'll share this presentation with Beth, and if anyone's interested, feel free to explore on catchhealthysmiles.org. For a teacher, they would complete a teacher training and then deliver the program. So these are the various components of the program. There's, as I mentioned, a classroom curriculum. There's the toothbrushing routine. There's a whole parent outreach, and there's a school-wide engagement piece. These are the primary implementers. The school leader is typically the school nurse that or the wraparound specialist. Then there's the teacher and PE teachers who are also engaged. And then technical assistance is provided by the intervention specialist and the Catch Global Foundation. So this is what the platform looks like. On the left, you have all of there's teacher resources, oral health FAQs and fact sheets, audio and video library, and all of the sessions that are presented that have actually, oops. Oh, there we go. So these sessions, so if you look at the first session, which is Healthy Smiles for Life, it has, the teacher can just download the lesson slides and play it in the classroom. And then there are some questions that the teacher can talk through. So there's probes, there's vocabulary that the teacher can print out for the word wall. So this is just a small snapshot. There's a whole host of resources. So this is what the slides would look like in the classroom. This is what some of the infographics look like for the parents. So there's a social media version, and there's a printable version in English and Spanish. So these are all of the topics that are covered in the curriculum. There's brushing, there's flossing, there's the dentist, and then tooth-friendly food and drinks. And all of these materials are available in English and Spanish for the parents that the teacher can send home or post on their social media. There's the videos are also available for the teachers to take links and send them in an email to the parents as well, or use them in the classroom. I mentioned this earlier, but our comparison schools actually received their Sun Safety curriculum on the same platform, the Catch Global Foundation platform. So that really has allowed for a nice comparison group. So I wanted to share sort of where we are at right now. It's a large study. We have over 1,000 children and their parents that we're targeting to enroll in the study. The study will actually be, we just finished our first wave of data because of COVID, given that we need to get a large number of schools. As y'all can imagine, it's been quite challenging to get schools to participate. However, this spring, we were able to complete our first wave of data collection and implementation. So I'll show you all some pictures from our implementation, but we collected data on our kindergartners and implemented the kindergarten curriculum, which actually went very, very smoothly. The schools really, the students really enjoyed it, and the schools really, they were impressed with the materials that were provided to them, and it was, honestly, I have to be honest, I was concerned about all things COVID and the implementation. However, I was very pleasantly surprised to see how well the implementation went. And so we'll have our wave 2 of schools recruited this coming year. This is a pretty long study. We won't be done until 2025 with all of our follow-ups. However, this study is critical, and it's critical because then we can have dollars that can be brought into dissemination of the program if it is found to be effective. And as we all know, for any, whether it's science or dissemination of health promotion, health education materials, there's a dollar sign attached to it. And so unless and until we establish the evidence base around it, that the program works and not just works on improving behavior, which is important. I'm a behavioral epidemiologist, but it's also important that it not only does that, but it also prevents caries and improves caries progression or reduces caries progression in high-risk population. Then we are really going to have that support in terms of reaching those the communities and the populations that need it the most. What is also nice is that the program, because we already have the Catch Global Foundation website that houses all of Catch materials, does the Catch trainings, as well as disseminates and provides that ongoing technical assistance. If it is found to be effective, it can be rapidly disseminated through Catch Global. I will share one piece of good news with the audience here that Delta Dental has been really interested in Catch Healthy Smiles. As I told everybody, we actually did our first pilot of Catch Healthy Smiles in 2017. So we've been working on this for 5-6 years. And Delta Dental has invested a substantial amount of funding to disseminate Catch Global, Catch Healthy Smiles in areas outside of Houston. Because we're doing the study in Houston, we cannot afford to have contamination a bias, because we have comparison schools in our study. So outside of Houston, in a certain geographical area, Catch Healthy Smiles is already available for implementation. And what we're doing is collecting data simultaneously there as well, not on caries, but just on behavior, at some of the touch points, because that's a lot of children, the dissemination. So if anybody's interested, you can, I'll provide in my last slide, I have the email if you're interested in bringing this resource to schools in your area and you're outside some of the Houston region, then you can reach out and they will bring it to you. So over the next 3 years, the idea is that Catch Healthy Smiles will be available to schools around Texas. So for the caries determination, we do, and this is not from our field, but this is similar to what we're doing in the sense this is by our Harris County Public Health dental colleagues. It's a visual assessment. It's a visual assessment of caries in the teeth. We use the ICDAS method to do the dental assessment, and our dentists have all been trained and calibrated and do a phenomenal job. We actually had 100% measurement of the caries of all the children who enrolled in the study. So that's a really phenomenal statistic to have. And then I wanted to also show the toothbrushing. So this is the tabletop toothbrushing that here, this is Nurse Paul at Bruce Elementary. We've developed curated several videos, short videos, 2 minutes, right? Because to sort of make it more animated and fun in the classroom for the kids to try the toothbrushing in the schools. And let me tell you, of all of the curriculum materials, this has been the biggest hit. It's the toothbrush, the kids love it, the music, and interestingly, the nurses love it. They have been very interested and supportive of doing this with the children in the classroom. And it's been really fantastic. I just, hot off the press, I'll share that we just yesterday looked at the data in the first wave of children that we did the dental assessment on. And almost 7 out of 10, these are kindergartners, 7 out of 10 kindergartners have caries experience in their teeth. This is our first wave of children that we measured. So just to show that we have a lot of work ahead of us, and we're excited to bring this into the classrooms, into the schools. And this is the last picture I'll show. This is another teacher. I love that she's worn the lab coat and again doing the tabletop toothbrushing with the children. Everything is COVID, COVID prevention friendly. Our dentists worked very hard in educating us and ensuring that the protocol that we developed, and the schools were, so every week as these were being implemented, we actually had observers go watch in the schools to see how the toothbrushing is going, if they can provide any technical assistance. And one of the pieces of feedback we got was how excited the schools themselves, surprisingly, they were surprised to be excited about it, and that it was easy to do and fit into the school day quite nicely. So I'll end by saying that if y'all are interested in Catch Healthy Smiles, you can send an email here at Healthy Smile. This goes to Catch Global Foundation. And if you're outside the Houston area, the program can be brought to your school. And if you're in the Houston area and want to be part of a research study or want to bring schools to be part of our research study, this is where you would want to send an email to. So again, thank you very much for the opportunity to present, and I'll stop sharing. I'm happy to answer any questions that folks may have.
Well, go ahead and leave go ahead and leave your contact information up there if you want to.
Sure.
Thank you, Dr. Sharma. This really does sound like a very comprehensive program, and it would be lovely if all the schools could implement this in their schools. We do have a couple of questions for you. The first one is, how would you rate teachers' involvement with all of the responsibilities that teachers are having? How did they feel about delivering the program?
Yeah, that's such a good question. Thank you for whoever asked that. So we've worked, with schools in implementing programs such as Catch, I've done it for the last 15 years. And one thing I have learned is that you have to make it easy. It cannot be one more thing. And that's not because teachers don't want to do it. It's because they literally just don't have the time to do one more thing. So one of the things that is critical to this implementation is both the mandate for oral health education that's come through the Texas legislature. So schools feel and know that they should be implementing this mandate, and that we are making it easy and bringing it to them. But more important than that is that Catch is already approved by the Texas Education Agency. And what that means is that the program materials are aligned with the TEKS guidelines. So every session, so we actually have a comprehensive mapping of all our session materials to the Texas Education and Knowledge and Skills guidelines. And TEKS are required guidelines by the state. So all schools have to follow, all public schools have to follow TEKS guidelines. And because Catch lessons are already mapped onto that, we make it very easy to the teachers. That's provided to the teachers during training and we make it very easy for them. We also have, as part of the training, one thing we do is action planning. They walk out of the training with their own action plan. And part of the action plan is, when do you think you can implement these components, and who will implement them? So for example, because the action plan will vary from campus to campus, depending on the support they have. And so teachers will say, oh, I can do, I plan to do the lessons Friday during my science period, at 2:00 or whatever it might be. So the action plan, it does two things. It allows the teacher planning time. And we usually do all of this at the start of the school year for Catch during their professional development days. And then it allows us to provide the technical assistance during that time. So we know that, oh, they're going to be doing this at 2:00 on Fridays. Okay, we need to, check in and make sure that they have what they need, or if we want to go observe what's happening, we can do that. So you have to make it easy. And then last thing I will say, you have to also highlight the school for really bringing these issues to the forefront. These schools, for example, know that they will be the pioneers in terms of really integrating oral health into their classroom in Texas. And so, we make sure we highlight them, bring them. Catch Global Foundation does a really nice job of highlighting the schools and the teachers and the leadership, so that there's, that marketing and communications piece that happens around it as well. But I would say the number one piece is that it's approved by Texas Education Agency. And so that kind of makes it, the teachers know that it's not one more thing, it's just what they can use as part of science, vocabulary, math, all of that. Sorry, that was a long answer.
Yeah, well, no, and that was really good. And that's really what makes it unique and probably so easy to implement, is because it integrates so easily in these other subjects. I do know that every ISD can choose the vendors that they choose the vendors, they hire the vendors for these curriculums. And so you can contact your local shack and recommend this Catch Healthy Smiles as the health and oral health curriculum for your schools. I love that it includes the nutrition part, the healthy eating and all that. So I really like that. We do have another question. Many countries around the world have already established and running coordinated oral health promotion programs in schools, like France and Germany, especially countries with universal health coverage. Have you looked at their data and experiences before starting designing Catch Healthy Smiles?
Sorry, but look, when you looked at their data in terms of the program pieces that are available?
I'm guessing it was from anonymous. If they would like to raise their hand, I'm glad to unmute you. We're happy to unmute you. Go ahead.
Yes, we did. So part of our, we went through a process for the development of the program called intervention mapping. And as part of that process, the first stage is doing an evidence review to look at what is out there, what has been proven to be successful, and then what has then been successfully disseminated and sustained. What are the costs associated with the program? What are the costs associated with implementation? And so we did do all of that, I think, back in 2016 or so, as we were developing, the components. So there are other school health, oral health promotion programs out there, no doubt, and they have various components, and the evidence based on it does vary quite a bit in terms of many of them have proven to improve behaviors. A few of them have improved incidence of caries, but What we didn't have is data specifically in high-risk populations. And so but we did use all of that information and worked very closely with our dental partners to develop something that is tailored culturally. It has to be culturally relevant. And we know, that our demographic looks quite different than the European nations. And so we took all of what we knew back and then developed the components based on that. The other nice thing about Catch, or the important thing, is that it's not okay, one and done. Because there's a Catch Global Foundation is its own 501c3, and the way it works is that UT Health investigators develop and evaluate Catch, and then Catch Global Foundation does the marketing and dissemination. So that's the partnership between the two organizations. But Catch Global Foundation is its own nonprofit. And what that allows for is ongoing sort of updating and keep the recency, both from the content, but also delivery. I mean, delivering a program is as important as the content. And so, so that's sort of the process that we use is, there's an ongoing updating of the materials and the delivery of the materials and all of that, and training as well.
Okay, thank you. Another question. Can you please explain a little bit about how you do screening for dental caries?
Yeah, we are using the ICDAS method for screening of dental care. That's the gold standard. And that's because one could use WHO, and dentists in the United States, for the most part, in clinical practice, I believe, use the WHO method, which is fine, but for our clinical, this is a clinical trial, we were told by NIDCR to use ICDAS. And so we actually had an ICDAS trainer who came down, and our dentists trained across the course of, I think it was 4 or 5 days back in December, and got calibrated, and dental recorders as well were trained. And so we've been using that method for the screening, and then the dental assessments as well. Yeah.
Okay, well, that makes perfect sense. Also, do you apply fluoride? Are y'all doing any fluoride varnish or SDF or anything?
No, we are not as part of this study. Yeah, but we do send a report. So based on the results of ICDAS, the parents do get a report of their child's dental health, and if there are any issues identified, then the parents are notified. Parents are notified regardless, but that's noted on the report. And then if they do not have a dental home, then we also work with them to see, okay, because our Harris County Public Health dental partners have such extensive reach, and they've done so many school-based dental assessments that we really lean on their expertise to help us answer many of those questions that arise.
Okay, before we go to efficacy and effectiveness, I want to talk about a little bit about parent involvement. Do you have any data on that or any reactions from them?
Yes, so we actually did, as part of our pilot, a pilot that took 3 years, but nevertheless, we wanted to make sure we were learning and gather. But this was, I'll be honest, this was a new area for us in terms of we've done a lot of work on diet, nutrition. I'm a dietitian as well by training. However, when you talk about the language of oral health, as you all know much better than I do, is different. as well as when you think about food, it's contextualized differently when it comes to oral health. And so we wanted to do due diligence by everything that we were developing. And so we've gotten a lot of feedback from both parents and teachers in terms of what we were distributing. The parents love that the school is involved in this. That is by far the most consistent feedback. This is the first time that they are very aware of there's some level of oral health promotion going on in schools, right? Like that's not, but what they are excited about is that the teachers are actually doing this in the classroom, and they're doing toothbrushing in the classroom. So they're excited. The parents like it that the school is actually involved in implementing it. And the second piece of feedback that we have received is how much they felt like they didn't know about baby teeth, or about flossing, or about visiting the dentist when children still have their baby teeth. So those were some of the surprising in terms of when should I take my child to what age should I take, there were some parents who were like, I don't know, I was waiting for the baby teeth to start falling and then take them to the dentist. So it's interesting to hear, and we heard the same from the teachers as well. So it's interesting, to hear. And then the nutrition part was surprising to some of them. They knew about the sugary beverages, but some of the facts around the sugary beverages and how they affect the teeth, and specifically the sodas, that has been, also eye-opening. So we are also evolving. They like the videos. We don't have as many videos, so we've gotten feedback that they like the short videos that they can do with their kids when they're brushing their teeth to keep the 2 minutes. So we're getting feedback on improving the program components as well.
And that's really, really important. I know, like you say, a lot of parents never realized, they did not know. So when parents take in their small children, their very young children, to the dentist, a lot of them say, why am I even here? They don't even have their permanent teeth, or they don't even have all their baby teeth. It may be before 2 years of age. And it really is because of the parent education that the parents or the caregivers receive, that really escalates and amplifies all of this behavior change at home. There's one last question that just says efficacy and effectiveness. I want to go back to a prior slide where I thought I saw something where it said you do toothbrushing in the classroom once a week. And I'm wondering if that shouldn't be every day, like every day after lunch. I know in Head Start, kindergarten, they do that every day. Now during COVID, they had to stop, but I will tell you that we have heard nothing but from pediatric dentists all across the nation that they have seen a huge increase in dental caries when those little children weren't able to brush every day at school. And I'm just wondering if that wouldn't help really take it over the top, as far as
thank you so much for actually saying that. That is the intent for Catch Healthy Smiles, to ramp it up to that. However, and I'll take your feedback back to the team. The one piece of feedback we got, especially because of COVID and being overwhelmed, and this was our first, time trying it out with the schools, is that let's start with 1 day a week. However, I completely agree with you. I'd like to see it every day, and then it becomes part of the norm, right? If you're doing it 1 day a week, that's kind of like, oh, here's the special thing we're doing. But if you do it, like you said, just make it part of the norm, the routine, then it's also, institutionalized faster. So that's definitely something that now that we're going to start with the first grade schools as well in our schools that are in wave one, we've been thinking about, okay, what is it that we can further push and layer on, and this is a big one. So I'll definitely take that back to the team.
Oh, good.
We couldn't
Well, because
agree
I'm thinking, any new ISD that wants to purchase this program as their curriculum, they could maybe do that every day. I don't know whether it was just this study or whether that's just part of their whole program, but yeah, I mean, if all the dentists are saying, hey, we see a difference, then I say, yeah, let's try to do daily if we can.
Yes, we'll consult with our team dentists and see how we can ramp that up. But thank you. That's great feedback.
And we really appreciate you joining us today. I do want to thank Dr. Sharma again for this wonderful presentation, and thank all of the attendees for joining us today.
Dr. Garner is here. I didn't realize, but Dr. Garner is here. She's one of our co-investigators on this study. That's exciting. Thank you for being here.
Oh, yeah. So I will thank you all again for joining us today, and I hope you have the rest of a pleasant afternoon and nice weekend coming up. Thank you, Dr. Sharma.
Thank you so much. Bye.